So far this morning there's been quite a lot of mention about cardiovascular function, biomechanics, a fair amount about fitness. Rob Curtis touched very briefly on respiratory, but that's what I'm actually going to focus on. And what I think I'm probably going to end up doing differently is telling you where, rather than giving you kind of telling you what we can do, is kind of tell you a little bit more about what I don't think we can do very well at the moment and where I think there might be some opportunities. Now, I'm going to start with something uncomfortable probably for most people, which is going to be going back to school level biology, but only for a couple of slides, so bear with me. We know that whenever anyone thinks of breathing, they tend to think about bringing oxygen in from the atmosphere into the lung, where it comes close to the red blood cells pick it up, and those red blood cells pump around the body by the heart to deliver oxygen to the cells in the body. And that goes to all of the cells, except of course the very strange thing is red blood cells themselves don't use oxygen. That's the one living cell that doesn't. The other part of it, you probably remember from your school biology, is that as a result of metabolism in the tissues, in the cells, we get carbon dioxide produced, and we have to get rid of that out of the body because carbon dioxide results in acidification of the body. Now, when we go to exercise, we can kind of start to think about the majority of the oxygen being delivered to the muscles. So tissues such as the gut, tissues such as the kidney, the blood flow to those is reduced and the vessels into the muscles are opened up to provide as much oxygen, much blood flow as possible. But the lungs are a little bit more interesting than just oxygen in and carbon dioxide out. And in fact, it's often overlooked that the lungs do a lot of other things. First thing is that the respiratory system's essential for control of body temperature. We've got the immune system, which the immune system within the lung is incredibly powerful. As we've said, the control of acidity, control is through carbon dioxide and bicarbonate, and that takes place through gas exchange. The lung's really important against protecting against infectious agents, things that are inhaled. It also releases and modifies hormones, and one of its most important roles is to filter either blood clots or bubbles. Now, we all know about pulmonary embolism in people. That's not great to have a pulmonary embolism, but it's much better than that clot or that bubble going into your brain or into your coronary artery. So the lungs sit in what is the largest structure of the skeleton, which is the rib cage. And outside the body, the lungs look pretty impressive. If you've ever seen them taken out and blown up, this is what we're looking at. This is where the rider would be sitting about here. This would be the head up here, the right side, left side. In the body, they do look slightly different. And here I'm going to attempt to show you what they look like. If you imagine we take this horse and we make a cut down here, and then what I'm going to do is throw away the back end, and then I'm going to come and stand and look in to the half that still remains. And this is what you would see just here. So here's the top. Here you can see the spine. Here, down here, you can see some of the ribs. You can see the back of the heart here. And here you've got the lungs. So sometimes we have this impression the lungs take up all of the space within the chest. They take up a lot, but they don't take up all of it. The lungs, however, are the third biggest organ. This is great if you do pub quizzes. Number one is the skin, number two the digestive tract, but number three is the lungs. So how important is the respiratory system when it comes to performance in horses? Well, it depends. People tend to think that the higher the intensity, the more important breathing oxygen is. And actually, they're right. In very simple terms, the harder the horse works, the more oxygen it needs. And that's pretty much a linear relationship. You work twice as hard, you need to use twice as much oxygen. Where does breathing come in? Well, breathing is very simple because it's almost in direct proportion. So if you need to use twice as much oxygen, you need to move twice as much air. The respiratory system of the horse is unusual because it is almost at its limit. When a horse is exercising maximally, basically it can't breathe anymore. The respiratory system as a whole is at its limit, and I'll explain why. But what it does is it's moving around 2 buckets of air in and out every second. It's filling 6 baths of air a minute. And the speed at which air reaches coming out of the nostrils at maximal expiration is 3 times the rate at which water's coming out of a fireman's hose. So this is a system that is working almost at its limit, and we shouldn't be surprised to find that a system in the horse during exercise is working at its limit, because if we think of tendons, we know that when a horse is galloping, the force on a tendon is very close to the point at which that tendon will break. So, yes, we can completely understand horses that are working hard that ventilation, oxygen and performance are going to be highly linked and closely associated, and that is absolutely true. But it's also true for horses that we might consider that are not exercising so aerobically or so intensely, such as show jumpers and dressage horses. But this is for a different reason. And the reason is that at Canter and Gallop, breathing and stride are linked in a perfect one-to-one synchrony in normal horses. So if a horse is cantering or galloping at moderate speed, over a minute, only about 1 breath should not be perfectly in sync with the stride. And that will usually be when the horse is changing legs or maybe is just adjusting its breathing. Any more than that of those, we call them uncoupled breaths, is an indication that something's not right. So we have this tremendous range in stride rates, say from 110 at a slow canter, maybe up to 170 strides per minute in a really fast striding, sprinting type horse. That means the respiratory rate is going to be the same because they go together. So the first thing here is that anything that limits stride, such as lameness, will also limit ventilation. Anything that limits ventilation, such as an obstruction in the airway, can also potentially limit your horse's stride. The two are intimately linked. So what limits performance? Well, Emmeline Hill we agree completely on genetics is your starting point. It always has to be your starting point. But once you've got your horse in front of you, what we know is that in the untrained, unfit horse, it's cardiovascular function that limits performance. However, if we take the trained horse, it's the respiratory system that limits performance. And there's a very, very easy explanation for that. The heart is a muscle. Muscles respond very well to exercise. The heart, if trained appropriately, will become larger and will have greater function. The thing about the lung, and you can forget everything you've ever read in every textbook, the respiratory system does not adapt to exercise in the horse. The capacity does not get greater. You do not get greater recruitment of blood vessels. You do not get greater ventilation. You do not get any change in mechanical function of the respiratory system with training. There are 3 different papers that have been published that have all shown by different groups that have shown the same thing. So at the moment, you can't train breathing. Why should that not be a surprise? Well, the horse's stride characteristics don't particularly change with training. If stride and ventilation are linked, how would we imagine that the respiratory system is going to adapt as well? It doesn't. How do we know the lungs limit performance? A couple of really easy examples to, I think, understand here. Oxygen in the air is 21%. If we make that oxygen 30%, which we can do with masks or altering the room environment, technically quite demanding, but it has been done. If we increase that oxygen there, the muscles will receive more oxygen, they will use more oxygen, and performance will be enhanced. So that's one thing that tells us that that system is limiting. There's another way we can do it. Instead of giving the horse air to breathe, which is quite dense, we can use what is used with divers, which is helium oxygen. Helium oxygen is much less dense, it requires less effort to move in and out. If we unload the respiratory system, more oxygen ends up being delivered to the muscles and performance is enhanced. So these are two very good pieces of information that we have that show us that the respiratory system is limiting in trained horses. So where are the problem areas? There's always a problem somewhere. Well, there's three real problem areas that the horse has associated with its respiratory system. The first is the upper airway. The second is in the trachea, the large conducting airway down to the lungs. And the third is in the lung tissue itself. The upper airway of the horse wasn't designed for prolonged exercise. The upper airway of the horse was designed for short periods of sprinting. It wasn't designed for 15 minutes of cross-country exercise. It wasn't even designed for a 2.5-minute race. Horses don't do that in the wild. The incredible thing is the range of things that horses can do that last for longer than a few seconds. But the horse is an obligate nasal breather. It has high obstruction to airflow here, in the turbinates here, and at the larynx here. It's not designed for what it does. We get a lot of problems in the upper airway, conditions such as laryngeal hemiplegia, dorsal displacement of the soft palate. These interfere with ventilation, they significantly affect performance. The thing about these and why I'm going to pass these on is because they're fairly straightforward to diagnose. We have now, this used to have to be done on treadmills, but we now have field-based wireless scopes where the vet can stand, look into the screen, watching the horse's larynx while the horse is galloping and can make a diagnosis. And there will never be a shortage of surgeons who can tell you they will cure it for you. When we come to looking at tracheal disease, again, fairly straightforward to diagnose. We have endoscopy, very easy to look down the trachea, and we can see what degree of disease we have here, and there are treatment options if the horse has disease. So again, I'm going to kind of skip on to past this. Same thing really when it comes to lower airway disease. We can, this isn't very technical, we just stick the scope further until it goes deeper into the lung. We can do what's called a bronchoalveolar lavage, which is a deep lung wash. It's not ideal to do because you need to sedate the horse and you usually use drugs to reduce coughing. So this can have an effect on the horses the time when a horse can race after having this done. But again, when we've got lower airway disease, equine asthma, then we have treatment options. What would be nice would be to go towards having also the option to do non-invasive diagnostics as you have in human medicine. So in human medicine now, bronchoscopy, endoscopy of the respiratory tract, isn't the first choice because one of the reasons being that people can often react badly to this and become pyrexic. It's not a pleasant procedure to have done as a person. It's quite costly. But if, and in people, there are techniques based on exhaled breath analysis which can pick up abnormalities, respiratory disease. And we are moving towards this with some of this sort of new technology that's coming out. This is a patient-side hydrogen peroxide analyzer that gives you a result in about 20 seconds. And probably those sort of technologies will change how we manage respiratory disease in horses. One of the big problems that we still haven't really solved, possibly can't ever solve in horses, is exercise-induced pulmonary hemorrhage. This is typically rupture of very small blood vessels deep within the lung. This is a horse, normal set of lungs. This would be a horse probably that was euthanized for orthopedic reasons. This one here, you can start to see maybe just a little bit of blue staining here. This is hemosiderin. This is iron deposits bound to protein. And here you can see this is a horse that has significant amounts of damage within the lung as a result of repeated episodes of bleeding. And it tends to start at the back here, and it tends to progress in this forward direction in a roughly sort of symmetrical pattern. If we were to look in the trachea of horses after intense exercise, we may see anything from tiny amounts of blood up to huge amounts of blood. In some cases, we see the blood at the nostrils. The problem is all horses that exercise intensely experience some degree of exercise-induced pulmonary hemorrhage, but we don't really have a treatment. Anyone from the States will tell you that Lasix is the answer. Lasix is a diuretic which reduces blood pressure, reduces the degree of hemorrhage when it's used on one occasion only. The evidence, all the evidence suggests that that effect becomes less the more times it's used. The same as happens in people, you develop tolerance to the drug. So Lasix isn't really the answer. Why do horses bleed in the lungs? Well, unfortunately, it's part of being really athletic. The horse has, this is a blood vessel within the lung. This is a capillary. This is the smallest blood vessel. These are individual red blood cells here. You can see this is the thickness of the wall that is separating the blood from the airspace. Now, that is incredibly thin, and it's what allows the horse to use oxygen at such a high rate. If the horse had a thicker capillary wall, it wouldn't bleed as much, but it wouldn't be as athletic as it is. And if you want to see what that looks like scaled up, that's a human hair, and that is the thickness of the wall in relation to that. So it's about probably a 50th to 100th of the thickness of a human hair. So it's not really surprising that horses do rupture these vessels under intense exercise. So unfortunately, we've got a lot of things potentially that lead to respiratory impairment. Respiratory impairment translates usually pretty directly to reduced performance. And one of the things that we still don't really have is any good commercial system to measure ventilation and gas exchange in horses during intense exercise in the same way that can be done in people. In people, it's pretty straightforward. There are lots of different companies providing that sort of equipment. For horses, this is a system I worked with back in the late 80s, only really usable on a treadmill. This is a system that was developed in Switzerland. This is a gas exchange system that doesn't measure actual movement of air in and out. This is the quad flow, or an early version of the quad flow system that Rob Curtis was talking about. This is the nearest we've ever really been to a commercial system. This was a system made by a company called Cosmed, who make the human systems. It works at kind of like slow canter, doesn't really work at high intensity exercise, not a very practical system to use, not very straightforward to use. So we could really do with some sort of affordable, accurate, practical technology to measure ventilation and gas exchange in horses in the field environment. One of the other things I think areas where we fall down with horses is in terms of air quality. We wouldn't accept low air quality for human athletes. However, we seem to be perfectly happy to accept poor air quality for horses, whether they're racehorses, eventers, polo ponies, whatever. And despite repeated numbers of studies showing, you do a survey, 80% of horses in a survey that are not coughing, don't have nasal discharge, do have signs of moderate to severe respiratory disease. And we kind of make excuses for it, or we just ignore it. It is having an effect on horses' performance. We have complete control over this as well, which is crazy. Your stable air quality is related to the bedding you put in, the forage you provide, and the ventilation. And that's pretty much it. It's not really rocket science, but we just don't, for some reason, want to seem to address that problem. And if you want to know what to put in and what not to put in, again, pretty straightforward. Either this information's out there, or it's very easy to take those beddings and measure the quality of them yourself. Whether we're talking about the levels of physical dust, or whether we're talking about the actual levels of mould. And you can see here, this typical type of wood shavings that are swept up off the floor of sawmills is the worst sort of thing you could probably use for horses. So what I'd like to say by finishing is that the respiratory system is one of the key parts to performance in horses. It's often overlooked. You can't compensate for any damage you do to the respiratory system by training it better. Basically, the respiratory system your horse has got from day one is the system it's going to have for life. Any damage you do to that has a negative effect on performance. At the moment, we have no way of practically measuring that respiratory capacity in horses or that respiratory function in the field situation. We have to infer what it might be. We can control the stable environment, but often we choose not to. And so horses end up with chronic subclinical respiratory disease. We have exercise-induced pulmonary hemorrhage that we kind of now and again get concerned about, and we try and think about, and we try and think how we're going to manage that, but we never really, it's too complicated, so we shelve it for a bit, then we come back to it. It's an ongoing problem. I think there are two opportunities going forward. I think this one is an opportunity, but I think it's technically very demanding. Having worked in this field with mass specs and ultrasonic flow meters, I know how demanding that is, but I think it's doable. But point of care devices for horses, such as exhaled breath, could be one of the way forwards for earlier detection of respiratory disease, monitoring treatment. And I also think there's the potential to look at, can we develop technology to train the respiratory system in the same way that we can do in people? In people, it's slightly easier because in people, you can dissociate your exercise from your breathing. So, for example, cyclists may entrain their breathing and their pedal frequency, but they don't have to. The horse has no option but to entrain its stride and its breathing together. If you can increase the strength of the respiratory muscles, the horse can maybe move more air in the same period of the stride. But that's not going to happen unless you can specifically train the respiratory muscles. So I think these are opportunities, and these are some of the things, two of the things that we could do with looking at perhaps more closely. Thank you.